Michael Gallagher, board certified clinical specialist in sports physical therapy, continuing our series on low back pain. One of the most common reasons for back pain that I see in my facility is sacroiliac dysfunction, malalignment of the sacroiliac joint. The sacroiliac joint, the joint between the sacrum, that lower part of your spine, and your ilium, the two hip bones. Very common in both men and women. We see a lot of sacroiliac dysfunction in women secondary to hormonal changes during certain times of the month, during pregnancy, carrying heavy objects or twisting. So we're going to talk a little bit about sacroiliac pain, how we treat it in the clinic, how you can treat it at home. As I said, difficult to assess on your own, always wanting to seek the help of your medical professional, but when we can't do that, what I'd like to do is give you a little baseline, trying to self-diagnose SI, joint pain, or sacroiliac pain, and how we can acutely treat it. So my patient generally walks in complaining about pain on one side of their back, usually in the area just above the buttocks, where those two little bony protrusions are. Many patients say, it feels like my back is stuck, it's not moving. I have pain when I turn one way. I can't roll over in bed. So the first thing I like to do when I'm assessing these patients, which you can do on your own, is have the patient stand. And what I'll do is I'll palpate or touch the posterior aspects. So I'll turn to the side. Those two little bones in the back. And without hitting your head, Shannon, I want you to bend forward. And somebody with sacroiliac, and slowly back up. Malalignment or dysfunction, what you'll find is if you're holding your hand stationary with each hand resting on the hip, bend again forward, one side will appear to move more than the other. And you can have your seat again. So when you're holding your hands this way, you'll find one side rotating and the other one is not. Usually indicative of the sacroiliac joint being stuck. When we think of a joint, we think of the shoulder or the hip, where we have a ball in a socket that moves freely. In the sacroiliac joint, the joint between the sacrum and the hip bone is a very rough and very uneven joint, so very easy for that joint to become out of place. Another way we can assess that in the clinic, and I'm going to have Shannon lie on her back, is called the long sitting test. And again, if you have somebody at home that can help you out, a good way of assessing if your pain is coming from the sacroiliac joint. Just move yourself back a little bit onto the pillow. You have the patient bring their legs, or your friend bring their legs straight out. You palpate or place your hands just around the ankle bones, and then you have the patient sit up. Now they can use their arms to help. Now this is somebody with back pain, so it may be difficult for them to sit up without their arms, but you're going to gently put a traction on their leg and have them sit up. Somebody with true sacroiliac dysfunction, it'll appear as one leg becomes longer than the other. This is what they call an apparent leg length. It's not an actual leg length. It's apparent in that one pelvis or one hip bone is not rotating or not sliding, thus causing the appearance of the leg becoming shorter when you go from supine to long sitting. So let's bring your legs over the edge. So now you've determined that I think this pain is coming from my sacroiliac joint. What should I do about it? Again, we can go with our basic modalities, heat, cold. I find with true sacroiliac pain, especially if you want to try to mobilize or get that joint moving, heat's usually a little more effective. Cold may be effective in handling or controlling the pain. Many times I'll start with heat prior to stretching and finish with cold in case we've caused any inflammation. But as we discussed in the past, it's really a personal preference at this time. So what we're going to do is have Shannon lie on her back again. And generally somebody with sacroiliac pain, we'll start with, like we do with most back pain, simple knee to chest or Williams exercise. So have the patient bring the knee up to her chest, grab with both hands, and hold for a count of 5. And down. And then the opposite leg, bring it up and hold for a count of 5. And down. And now because I feel that the pain may be coming from that sacroiliac joint, what I want to do is open that joint up. Allow that joint to move. So have Shannon repeat the same exercise, bringing her knee up to the chest, but now coming across her body and trying to bring it to the opposite shoulder. Opening up the sacroiliac joint, hoping that musculature will allow that sacroiliac to slide back into normal position. And down. And And now the opposite leg, so it's up, grab with both hands, and across to the other shoulder, and hold for a count of 5. And down. Another stretch you can do for sacroiliac pain, especially when you have sciatic pain along with that, is a piriformis stretch. We talked about that little muscle, the piriformis, which sits directly on top of the sciatic nerve. Piriformis stretch will have the patient cross her leg, and again, now do a knee up to chest exercise. Grab with your hands underneath chin and give a stretch. So you're stretching out that small musculature in the buttocks. What I'm trying to do is have the patient just get that joint area moving. In the physical therapy facility, in my clinic, I would do some sacroiliac mobilization techniques. Not a manipulation, not a pushing or forcing in of the joint into place, but just have the body actually kind of pull that joint into proper alignment and bring it up and hold. Again, also a good stretch when you're having sciatic type symptoms to stretch out the muscles sitting directly on the sciatic nerve if you can tolerate it. All these exercises are, again, as tolerated. If you're having increased pain or increased pain, just decrease or stop the exercise. You don't want to make your pain worse. Anytime you're doing stretching or strengthening exercise, we should never work into that painful range of motion. Discomfort, fine. Pain, definitely not. The other technique that I like to do with sacroiliac dysfunction is a muscle energy technique. What we do is get muscles pulling in the opposite direction. So we know our hamstrings sit on the posterior, the back part of our leg and pelvis, and our quadriceps and hip flexors are on the front part of our leg. So if we can get those muscles working in the opposite direction, almost like a scissor, many times that will help to rotate or pull the sacroiliac joint into place. Now in the physical therapy clinic, it's much easier to assess which side appears to be forward or anterior and which side appears to be posterior. At home, that's a little more difficult. So I usually have the patients try it in both directions just to get that joint moving more freely. So the best way to do this is home is I'll have Shannon bend her knee, place both of her hands on her leg here. At the same time, she's pushing up into her hands, she's pushing down into the table with her opposite leg. Again, causing a scissoring. Her hamstrings working here into the table, her quadriceps working here, causing a rotation at the sacroiliac joint. Now, as again in the clinic, I would probably be more specific in doing it one side versus the other. It's difficult for a patient to determine if they're anteriorly or posteriorly rotated, so it's fine to try it on both sides, and hopefully one will work. Many times a patient will report they felt a pop or a snap, almost like cracking their knuckles. This is usually followed by instantaneous relief of pain coming from the sacroiliac joint. In our next video, we're going to talk about strengthening, general strengthening for the back, for the SI joint. So hope to see you soon.